Today, I'm going to talk about what you should do after dental surgery, which could be a tooth extraction, a dental implant, a sinus lift, or gum surgery for good healing and fast recovery. And then some of the homeopathic natural home remedies to manage swelling, bleeding, and pain, and how to reduce the need for antibiotics, opioids, and narcotics. I'm Dr. Maryam Horiyat at Aria Dental, a holistic, biological, integrative, and zirconia dental implant center in South Orange County of California. Starting off with a disclaimer here, some dentists have their own post-operative instructions after your dental surgery. It is very important to confirm with your own dentist if my information works for you and does not interfere with their instructions. What I'm about to tell you works very well for me and my patient with our holistic approach to dental surgeries, especially holistic extractions. Pain and bleeding are the most common complication after you have had dental surgery. But infection or dry socket is another frequent complication that can happen after oral surgery as well. It is very important to follow this general advice to give you the best chance of a speedy and painless recovery to minimize post-op pain, risk of infection, bleeding, and dry socket. This general advice is mainly about: number 1, local anesthesia post-operative instructions. Number 2, diet or eating restrictions. Number 3, alcohol and smoking restrictions. Number 4, exercise, sauna, and steam room restrictions after your surgery. Number 5, bleeding management. Number 6, swelling and bruises. Number 7, pain management. Number 8, sutures and stitches. Number 9, home care and oral hygiene. For your dental surgery, local anesthesia has been given. Local anesthesia helps you minimize the pain during and after your dental surgery. Your mouth may continue to feel numb for a few hours after your surgery. Do not suck or chew on your numb lip or cheek because this will increase bruising and more pain. Number 2, diet restriction. Start with a soft diet and gradually build up to your normal diet. Make sure your food and drinks are not too hot, as they may cause more bleeding and scald your mouth. Make sure you do not use a straw to drink for at least 7 days after dental surgery. Make sure your food is not too spicy or acidic. Spicy and acidic food can irritate your mouth and gum. Do not eat anything hard or sharp, like nuts, chips, pretzels, or anything with seeds like some berries for at least 2 weeks, or at least until your post-op appointment with your dentist, when your dentist could evaluate your healing process. Number 3, smoking and drinking alcohol should be avoided until your next post-op appointment, or at least for 1 to 2 weeks after your surgery, as these may lead to complications like bleeding and poor wound healing. You also want to avoid mouthwash with alcohol for at least 2 weeks after your dental surgery. Number 4, avoid exercise, weightlifting, sauna, and steam room for at least 3 days or even more, depending on the extent of your oral surgery. Please consult with your dentist about how long you should avoid exercise. Number 5, bleeding should stop after your oral surgery, but you may experience some slight oozing of blood for a few hours. So do not worry if you taste blood in your mouth and find out that your saliva is reddish in color. The holistic approach we use at our office with a laser and ozone treatment, LPRF and PRP treatment, and suturing, post-op bleeding complication has almost never happened to our patient. Bleeding is when you see blood constantly flowing out of your surgical site. If there is excessive bleeding, gently wipe away clots around the surgical area, fold a piece of gauze and place it directly over the wound and bite down for 10 to 15 minutes. If you don't have sterile gauze, you should use a tea bag. The tannic acid in the tea bag helps to stop bleeding. When you're removing the gauze, make sure you're not pulling your suture with it. To prevent choking, do not eat or drink or sleep with the gauze inside of your mouth. Number 6, you may experience some swelling, which could get worse gradually over the next 2 to 3 days. Do not place a warm compress on the area as it worsens the swelling. The first few nights after your surgery, when you sleep, make sure your head is slightly elevated above your heart to reduce the risk of bleeding and swelling. You could use ice pack. but keep it gently over your face, around the area of surgery, but make sure you do not press it against the surgical area. Natural arnica, ruta, and chamomilla help to reduce swelling. Less swelling and inflammation means less post-op pain. Number 7, bruises. Bruises may appear on your face, jaw, and even on your neck. This will fade away after 2 to 3 weeks. Taking natural bromelain or quercetin peels work well for bruises and inflammation. Remember, pineapple and raw papaya have a very high source of bromelain. Arnica and hypericum also help to reduce bruises after oral surgery. Number 8, remember to keep your mouth clean by brushing and rinsing gently after each meal. Make sure you avoid mouthwash with alcohol for 2 weeks. I don't recommend rinsing and gargling too much. Do not use vigorous rinsing and water pick around the surgical areas for at least 2 weeks after oral surgery. Natural substances that work like antiseptic and help to reduce the risk of infections are: number 1, calendula; number 2, echinacea; number 3, silicia or silicia. Ozone oil, like hemp ozone oil, is also a great option to prevent infection. In our office, we use ozone water and ozone gas injection that help us to avoid antibiotics in more than 95% of our patients. Practice good oral hygiene. Remember, excessive brushing and flossing could irritate your mouth, but similarly, not keeping your mouth clean enough could increase the risk of infections. Also, make sure your toothpaste, even your holistic toothpaste, is not acidic and has a pH higher than 7.0 for faster healing in a less acidic environment. Number 9, sutures. In some cases, your suture is resorbable and dissolve on its own, and in some cases, suture needs to be removed by your dentist. Regardless of the type of a suture, you should avoid touching and pulling your sutures. If the string of sutures is irritating you, please contact your dental office. Number 10, to relieve pain, take pain medication recommended by your dentist, like over-the-counter Advil and extra-strength Tylenol together at the same time, or a prescription pain medication. You could also use home natural remedies or non-opiate homeopathic substances to reduce pain, such as Ignatia, Ledum palsutre, Silicia, and Staphy's sagria. Here are 8 other natural home remedies you could use after dental surgery. Number 1, warm salt water or saline are ideal for irritated areas inside of your mouth. They are very soothing on your gum and soft tissue. Warm up water, add salt, stir, and gently gargle for 2 to 3 times a day. Number 2, sage, a useful homeopathic medicine for sore. To make a sage mouthwash, simply soak 2 teaspoons of dry sage in some boiling water, then let it cool and rinse your mouth 2 to 3 times a day. Number 3, turmeric powder, a great soothing substance that is used for both pain and inflammation. Mix honey with turmeric and apply around the surgical site. Number 4, mixture of essential oils such as peppermint and eucalyptus oil that have anti-inflammatory effects. Number 5, licorice root is beneficial because of anti-inflammatory components that safely soothes the pain in the soft tissue after extractions. Crush the root and put 1 teaspoon into the warm water, let it sit for 2 hours, then rinse your mouth with that mix gently. Number 6, drink chamomile tea or chamomile compresses. Chamomile tea is well known for easing inflammation and pain. Number 7, clove oil. Clove oil is used for immediate relief from oral surgery pain. To do this safely, use a carrier oil like olive or coconut oil with clove oil. Apply half a teaspoon to the cotton pad and press it around the surgical area for 5 to 10 minutes. Number 8, apple cider vinegar. Apple cider vinegar is another alternative safe mouthwash. You also could apply apple cider vinegar directly over the extraction site by using a cotton swab. If you got a painful dry socket, make an apple cider vinegar dressing by dipping a cotton ball in the vinegar and placing it on the dry socket, holding it there for 10 minutes at least. Along with these home remedies, make sure you take supplements such as B12, folic acid, and irons if you're low on these. Vitamin D is essential for bone formation, especially after dental treatment placement and sinus lift. Make sure you sleep well and do not forget meditation to reduce your stress for better healing. I hope you find this video very helpful. Please like and subscribe to our weekly video about your oral health.